I am your patient. I am in the crisis unit with my mother on a 302 committal, escorted by the police in their comfortable van with those oh-so-stylish bracelets. I have a previous diagnosis of bipolar. I am very manic and incoherent. I have been self-medicating with alcohol and crack cocaine. I have been off my meds for 3 months. I'm here in the 302 committal because I tore up my apartment and one of my children was hurt. I'm ineffective as a mother. Mental health team, please help me.
I am the intake RN in the crisis unit. My main objective for the patient upon her arrival is to ensure her safety and gain her trust. I will assess the patient's vitals and perform a physical assessment, paying careful attention to any physical markings. This will give the team an idea of whether or not the patient has previously hurt herself and if she has any self-inflicted wounds while she's in our care. Once the assessment is finished, I will interview both the patient and the patient's mother to determine the sequence of events that led to her committal. I will also obtain a statement from the officers that brought the patient in.
I am the psychiatrist on the inpatient unit. I prescribe the patient meds and diagnose following the guidelines of the DSM-4. I help the patient improve their chemical imbalance and mental health. I work closely with the psychologist and behavioral therapist to counsel the patient. I also work with the psychologist and determine how the behavioral treatments are going.
RN in the inpatient unit. Our patient is suffering from sleeplessness, flight of ideas, reduced ability to filter external stimuli, increased energy, and high-risk activities. She's been prescribed lithium. Lithium protects against the effects of bipolar depressive cycles. Lithium competes for salt receptors and affects glucose metabolism. It crosses the blood-brain barrier and placenta and is distributed in sweat and breast milk. We must ensure she is not pregnant. We will monitor her lithium levels every 2 to 3 days so they are in a therapeutic range of 0.5 to 1.5 milliequivalents per liter. We will monitor food and fluid intake, her rest and sleep schedules, and focus primarily on safety.
I am the social worker. I collaborate with the staff to make sure treatment is going as planned. I encourage compliance with prescription meds and help patients develop skills for dealing with issues in everyday life. When treatment is complete, I also help with discharge plans such as self-medication training, acquiring housing, and organizing outpatient treatment.
I am the intensive case manager. I work with the client to transition to the community, home, and school. I can arrange transportation and assist in medical, therapeutic, and legal appointments. I ensure their medication regimens are followed. I am an accessible advocate.
We're the mental health team.
They brought me from mentally ill to mentally functional.
People say I'm crazy, just a little touch. But maybe scholars remind me of Psych. That's why I always feel like somebody's watching.
No, let her do that because you can't put those in her mouth. Oh yeah, duh. I was so stupid. I was like, swallow that.
One more time. You go here. Ain't nothing wrong with you. Go here. That's here. That's here. Out of here. That's here.
You're fine. You're not in it.
Now what happened before you got here? Did you feel like a little Tom Cruise thing? Tom Cruise.
Remind me of Psych.